One of the major responsibilities of the government is to see to the well-being and wellness of its people by putting in place policies in the health sector that will make Medicare accessible to the majority of its populace. The Prince Dapo Abiodun-led administration since assumed office has taken the health and well-being of the people seriously with the launch of the Basic Healthcare Provision Fund program and the Ogun State Informal Sector Health Insurance Scheme. This forms part of the state's policy on affordable and accessible healthcare delivery for all the citizens. Prince Dapo Abiodun affirmed that social well-being remains a vital part of the Share mantra aimed at improving the well-being of the citizenry.
It is indeed another milestone in the successful and continued implementation of the Building Our Future Together agenda in Ogun State.
Governor Abiodun says the scheme Christian Ileradero is poised to assist both formal and informal sectors at accessing basic healthcare services.
As an administration, we have a blueprint that defines our social contract with the good people of Ogun State with the acronym ISHEA. I for infrastructure, S for social welfare, E for education, Y for youth empowerment and job creation, and A for agriculture. To interest this gathering to know that the importance of social welfare, which is the second pillar of our mantra, is our commitment to the provision of the required infrastructure and measures towards ensuring the well-being, wellness, and welfare of our people at all times. As an important kernel of this contract, the provision of qualitative healthcare service delivery to the people is a mark of a local statement of intent. That is, only a healthy populace can enjoy the provision of infrastructure and tap into the available economic potentials of our dear state.
The governor, who was the first person to be registered, encouraged the residents to seize the opportunity created by the state government to annex the scheme.
The 12,000 per annum payment is payable in 1,000 naira per month, so it's not unnecessarily burdensome. And for the family scheme, which is meant to be 48,000 naira per annum, it translates to 4,000 naira per month. And I'm sure that all of us can afford to pay 4,000 naira per month for a family scheme.
Also, the Executive Secretary, National Health Insurance Scheme, Professor Nasiru Sambo, says with satisfaction that the health delivery in the state mirrored the federal government policy on affordable and accessible healthcare delivery for all Nigerians.
I'm very delighted to be part of this historic moment in the nation's efforts towards improving the quality of life of the good people and hospitable people of Ogun State. I especially thank His Excellency, the Executive Governor of Ogun State, Prince Dapo Abiodun MFR, for the privilege to witness the launch of the Basic Healthcare Provision Fund and implementation of informal sector health insurance scheme in the gateway states. This is in alignment with the objective of achieving universal health coverage, which is one of the top priorities on the global agenda, as well as integral part of sustainable development goals. In pursuit of this goal, the present administration of President Muhammadu Buhari GCFR is working assiduously to ensure that every Nigerian has access to affordable quality healthcare services.
The former State Commissioner for Health, Dr. Tomi Koka, says the program was aimed at ensuring that residents in the state have access to affordable healthcare services.
The launch of the Basic Healthcare Provision Fund is to ensure the provision of qualitative, affordable healthcare service to Ogun State residents with major emphasis on the poor, the vulnerable in the society, such as pregnant women, children under 5, the elderly above the age of 65, and the disabled. This laudable program is to be implemented by the government through Ogun State Health Insurance Agency in partnership with the Ogun State Primary Health Development Agency. Through the support of this administration, Ogun State has fulfilled all conditions to qualify for this federal government initiative, hence the launch that we are holding today.
Dr. Afolabi Dosunmu is the Executive Secretary, Ogun State Health Insurance Agency, and he spoke extensively on the health insurance scheme in the informal and the formal sector.
The history of health insurance in Nigeria is not complete by not mentioning the fact that it all started in Ogun State. In two communities, Alaidowa and Leguru community in the Jebu zone of the state. Ogun State is known for blazing the trails in so many things, which also, one of it is also insurance. And in the 80s, those communities came and were running one or two insurance schemes. In fact, till now, I think Leguru community is still running that very small insurance scheme that they started even then in the 80s. I will give kudos to the administration of Prince Dapo Abiodun, MFR, who immediately came in, helped us to meet some commitments or criteria that we needed to meet at the federal government level, one of which was the payment of 100 million matching grants. The 100 million was given to us, and of course, we started what is known today as the Basic Healthcare Insurance Provision Fund. There are basically three types of schemes that every health insurance agency is running. One is the formal sector scheme. The second one is the informal sector scheme. And the third one is the vulnerable scheme for people that just can't afford to pay or they are vulnerable. The Basic Healthcare Provision Fund scheme is an example of a vulnerable scheme.
Dosunmu explained the innovative strategies that will be employed to ensure widest coverage.
We've actually done a lot. And if I quote 2022 enrollment figures for you, that is the Basic Healthcare Provision Fund and the informal sector put together. We enrolled over 55,000 people last year, which is a very big stride when you compare it to other states. We still need a long way to go. Of course, 55,000 enrollees is small when you look at all the people living in Ogun State. But this is we're just starting, and things are getting better every day. For the informal sector scheme, some of the things we've done is that we've had some television shows to create awareness, radio programs to create awareness. We've signed Odunlade Adekola as our brand ambassadors. We've done some road shows, and I'm happy to tell you that people now come in to come and enroll. Almost every day you see people. We have agents in all the local governments of the states. So people go there and enroll because compared to maybe 5 years ago, more people are beginning to be aware about the benefit of health insurance. We've now launched that informal sector scheme. And with that scheme, anybody that wants to can come in and enroll for just 12,000 naira per year or 1,000 naira every month. And the benefit is immeasurable.
He rolled out the benefits of the scheme and its sustainability.
We've had a lot of success stories. When you look at about the informal sector scheme, success stories about lives that have been changed, that have been saved. Someone who went into labor, had some complications, had to be rushed to OUTH, and at the end of the day, spent about 15 days there in their intensive care unit and came out with a bill of about 980,000. And insurance paid. We have success stories like a woman who delivered triplets in a PHC. They didn't know it was triplets that she was carrying. Delivered triplets. Luckily, the doctor for the local government in Ogun Waterside was around, knew that the triplets had some issues breathing, called us, and we moved them from Ogun Waterside around 12:30 p.m. in the middle of the night to OUTH. This woman and her triplets spent about 6 weeks in OUTH, and we bought the bill. She's there in Waterside, happy that, thank God, she came on the health insurance scheme. We have success stories about a lot of women that have done cesarean sections, twins, and so on and so forth. We have men that have done prostatectomy. That's a disease condition that is common to men. They are the one that have prostrates. And just for come and enroll for 12,000, we take care of those operations for you. So there are people out there that we can leverage on. We have what we call a benefit package, which lists all the disease conditions that we'll take care of under insurance. What we did in Ogun State was that we looked at the disease burden. Those are the diseases that are peculiar to the people living in Ogun State. We look at those disease conditions, and we came out with a benefit package that take care of about 99% of the disease conditions in Ogun State. And those 99% of those disease conditions are in our benefit package. So when I say it without any fear that almost anything that anybody can suffer when it comes to illness or diseases in Ogun State, both medical and surgical, is in our benefit package. And I'm very confident about that. Why it is not 100% is because currently we don't take care of cancer at an advanced stage. We don't take care of renal, kidney problems and transplants. But almost every other thing. Let's talk about chronic illnesses. Hypertension, diabetes, arthritis is there. Let's talk about surgical things that women usually complain of. Fibroid, goiter, it is there. Cataracts, glaucoma, it's there. Let's come and look at what men usually complain or go to surgery for. The prostate problems, it is there. And TB, HIV, and of course, without saying malaria, typhoid, and all those common things, they're out there.
The health insurance scheme in the informal sector requires some process. Dr. Dosunmu explained this.
Wherever you are in Ogun State and you want to register for health insurance, all you need to do is one, either you go onto our website and you fill a form there, and we'll get back across to you and then ask you for some other details and also find a way of taking your pictures. Or we link you up with our agents, and we have at least one agent in each local government of the state. There are some local governments that have about 2-3, depending on the size. Obviously, Ekpokia, Dodota, and Obafemi, and so on and so forth. Thirdly, what we also done very recently is that we've put some officers in some of these our hospitals. So if anybody calls me now and said, I'm in Imeko, I'm in Ekpokia, I'm in Ogunwota side, and I want to enroll, all I need to, what my staff need to do is to ask, where you specifically? And once we get that location, we will to now say, either you go to this person, this office or this place to enroll, or sometimes, if you have about 10, 20, 30, 50, 100 people enrolling, if our agents will come and meet you there. So for example now, let's say somebody living in Abeokuta South calls and say, I'm living in Kuba. And we look at where our agents are. I will just easily say, go to Kuba PHC. Because I know that there's an officer currently sitting in Kuba PHC who will enroll you. Does not mean you have to pick Kuba. But the person, we have an app that works on our Android phones. The person will enroll you. You will pick whatever hospital you want to pick. But it comes into our system and then you enroll. So it's very simple, very easy.
He then explained steps taken by the agency to collaborate with stakeholders at developing strategies of Ogun State Health Insurance Agency in the informal sector.
The NURTW, RTAN, ROMO, Akomoro, and so on and so forth are in the informal sector. We actively write them, try to visit them, attend their meetings. That is one of those strategies we've put into place. So if today now, I don't want to advertise for any one of them, but we visited quite a large chunk of these artisans. We've called all the markets. For example, now we've called all the markets women leaders, the Iyalojas and Babalojas. We've had about 2 levels of meetings with them, and we've done things like that.
Some of the beneficiaries of the scheme in both formal and informal sectors asked this to say.
The program is okay, and for the benefit of those that did not have much. So, and my advice to fellow women is to join the program in order to be a beneficiary. And also, I want to use this medium to appreciate our Governor, Prince Dapo Abiodun, for the wonderful job he has been doing so far. And I pray that the Lord will continue to strengthen him. He have started well and he will end well in Jesus' name.
What I can say about this is good and can appreciate the governor.
Without mincing words, the state government has left no stone unturned at improving the health and well-being of the people through this scheme. The onus now lies on the people of the state to key into the scheme by registering. By doing this, Medicare expenses will be reduced and accessible. Ìgbéga ìpínlẹ̀ Ògùn, àjọṣe wa ni.